morning, everyone. I'm Katie Van Fossen, and today I'm going to be presenting on my project entitled Family Functioning in a sample of African American caregivers and their children. So what we know regarding mental health service utilization is that racial and ethnic minority youth receive considerably fewer mental health services than their non-minority peers. Specifically, African American youth are less likely to receive any kind of medical health services or specialty care for their mental health challenges. And we know that African American adolescents are at an increased risk for experiencing any class of psychiatric disorder compared to their Caucasian peers. And regarding the SAMHSA strategic initiatives of preventing substance abuse and mental health and increasing healthcare access and minimizing healthcare disparities, I want to talk a little bit about one aspect that might be underpinning this relationship between who does and does not utilize services. There are many aspects of culturally tailoring interventions that are important to talk about. Today I'm just going to be talking about how do we identify families and some of the limitations in our psychometric measures. So family functioning is this concept which measures a family's ability to work together and to meet their basic needs. This can be affective, like our emotion, and our physical needs. And what we know from the literature is that impaired family functioning in children is associated with some pediatric illnesses that range from cancer to obesity. It is associated with child mental health symptoms. And there's some literature that indicates that it might actually be the thing that mediates the relationship between physical health presentations and mental health presentations in families. And so the Society of Pediatric Psychology actually recommends a specific model of family functioning, the McMaster Family Assessment Device. And what's excellent about this model is it includes a clinical interview component, observational coding, as well as self-report measures. And there's a 60-item measure that has multiple domains that you can examine of family functioning, but it also has a brief 12-item measure that is just this kind of global general family functioning. And it has these clinical norms and cutoffs so that you can distinguish between healthy and impaired families. But what's a little bit problematic is that the initial validation studies were done in Canada, and so they're reported on as being diverse, but there's actual income diversity and religion diversity, but they don't have any racial demographics that they report on. And so a lot of us have adapted these measures and used them in our studies, kind of assuming that it was this inclusive form of diversity. And it's even been translated into Spanish. There have been a number of researchers who have relatively nationally representative samples, 18, 17% African American, large data sets using this. But we haven't actually taken a step back to see just solely African American samples if this measure is appropriate for use with families. And additionally, when we have looked at African American families, we're looking at families who are already presenting with clinical concerns. So they're coming in and saying they have a problem. This one sample, it was all families who had an identified patient with schizophrenia. So when we're looking for normed community psychometric measures that are appropriate, we maybe need to take a step back and re-examine some things. And so that was the purpose of our study. We looked at an African American community sample, and we looked at the psychometric properties of the general functioning subscale. We wanted to see, is it reliable? Does it have convergent validity with this idea of family functioning? And then additionally, there was one study that used only the 6 positively worded items, proposing that potentially negatively worded items, I don't get along well with my family, cause people to kind of pause and take a step back and maybe respond less accurately. And so we wanted to also look at this 6 positively worded item scale and see if there were any differences in fit for families. Additionally, we looked at other demographic factors like education, weight status to really better understand this measure. So our data was collected using the Ohio State African American Community Extension Center and Research Match. We surveyed 54 caregiver child dyads, and the children needed to be between the ages of 7 to 13 and identify as African American. And they also had to be residing in the home with their caregiver. The caregivers completed demographics questionnaires. They are the one that completed the family functioning assessment device, and some different questionnaires around physical activity and nutrition. The children also completed measures around physical activity and nutrition, as well as an assessment of their parents' parenting style. So we ran a single factor confirmatory factor analysis using AMOS. Our data met all assumptions for normality, and we used maximum likelihood estimation to handle any missing data. And you'll see that on its own, this model with no correlated error terms, it had really low fit. And so in order to account for some of that unexplained variance, which might have been some other variable that we didn't include in our model, we correlated our error terms. And you'll see it demonstrated adequate fit. These fit indices are acceptable. So this measure would, in its entirety, in the 12 items, would be appropriate for use. We see that it identifies around 23% of families as being above that clinical cutoff, so experiencing impairment. And this is just in a community sample. These people are not seeking any kind of services or treatment. And our reliability, the scale items all held together and looked good. When we look at just the positively worded items, though, this is what was really fascinating to me, we see our model fit increase. So when we're looking at working with African American families, it may be, you can look at some sample items, we confide in each other, that when we are asking questions about the strengths of families, that we glean more information. And it actually also becomes more sensitive. So we went from around 23% of families being identified as above the cutoff or impaired to 28% of families. When we look at some demographic differences, we really don't see major differences by education or statistically significant differences. We did have some differences that were marginal. So families receiving government-assisted insurance, and that's the child's insurance care, reported marginally more impairment than families who were on private insurance. We also see, and this finding is really interesting, I can't wait to explore it more in a larger sample, when we look at all samples, including Caucasian families, Hispanic families, and we lump everyone together, family functioning tends to be impaired in families that have an overweight or obese child. But when we're looking at just the subgroup of African American families, we see that families with an overweight or obese child actually report marginally less impairment in family functioning than families with a healthy weight child. So as far as what are the implications of this is just the tiniest step in working on that service utilization. What we know from this study is that this scale is appropriate for use. It seems to demonstrate some level of convergent validity. The scales were reliable. But what's really interesting is that brevity is the friend of the researcher and the clinician, and so we have an actually potentially more effective and sensitive measure using just the 6 positively worded items. And we see that additionally, families who were not seeking any kind of services, around 22 to 28% of those families were experiencing impaired family functioning. And again, these norms, or the clinical cutoff, was developed in therapy. So that cutoff is families who were actually seeking treatment. There are some obvious limitations of this study, very small sample size, which kind of precludes detecting any kind of effects that were less than moderate. We have cross-sectional data, so that's going to preclude any longitudinal assumptions about the relationship between family functioning impairment and child mental health or physical health symptomology. And the last part is that it was a single reporter on general functioning. So if we're looking for some kind of global picture of the family, it would be really nice to have multiple reporters filling out this and looking at their congruence. As far as where we would like to take this, we would love to see multiple reporters and continue to look in communities of African American families to not only identify impaired functioning, but also identify strengths that can be utilized in healthcare with tailoring and adapting intervention services.